Welcome back. We continue our coverage of seniors and the coronavirus.
Maybe you are one of the thousands of Nevadans who willingly opted to get one of the several COVID-19 vaccines, but maybe you are someone who is still unsure if it's something that you want to do.
Here's Dr. Robert Dalrymple with Northern Nevada Medical Center to answer some of your questions that you may have about the COVID vaccine.
When you look at our senior populations, those people, they're the ones that are affected the most. They're the ones that are actually in the hospitals, in the intensive care units. These are the people we really need to protect. So it makes so much sense from a risk-benefit process to say, yes, there are certain risks. Nothing is 100%, but the risk of being in the hospital on a ventilator, let's say, unfortunately, that's always a possibility. You know, the benefit of getting the actual vaccine is going to far outweigh those risks. Right now, we're seeing more supply, especially now that the J&J has been reapproved and recommended for use. So we should see more traction when it comes to the availability of all these vaccines. So it's going to be really important as people seek out the vaccine that you, being in the older population, get the vaccine as quickly as possible because it may not be available as more people want it. So it's good to reach out to your primary care provider, the health district. There's great websites, great information on how to get those vaccines scheduled. I think it's paramount that you talk with your primary care provider, whether it is a nurse practitioner or your doctor, and really rely on their information, their experience as well, because they have other patients, that are having similar questions, similar trepidation, and they can hopefully walk you through this process of making that final decision. Yes, it's a good idea to do, it's safe, it's effective, and it's what we have to prevent COVID from spreading.